Hi, my name is Annie Pierce, and I'd like to talk to you about what is cancer. Most people throughout the medical industry are pretty much in agreement in their definition of cancer. Wikipedia offers these two definitions: the disease caused by an uncontrolled division of abnormal cells in a part of the body, and 2, the malignant growth or tumor resulting from such a division of cells. While everyone identifies and agrees with the uncontrolled cell duplication of abnormal cells, I haven't seen anyone from the medical industry examining two very important aspects of the primarily accepted definition, which must be considered if one is to fully understand this amazing disease. Why or how did these cells become abnormal in the first place? And secondly, why are they duplicating uncontrollably? If you look carefully at the wording of the first definition, the disease caused by, which means to me that the uncontrolled division of abnormal cells actually causes the cancer to become present, and that is not the case. I think it would be more accurate to say that cancer is the disease characterized by an uncontrolled division of abnormal cells in a particular part of the body, because the uncontrolled division of abnormal cells is the disease itself. So, here we have the definition. Cancer is the disease characterized by an uncontrolled division of abnormal cells in any part of the body. I think that it is important to understand that cancer is not the problem, but just one of the many symptoms of a more serious problem called oxygen deficiency. And not enough people in the medical profession are talking about that, one single significant fact. Even in cancer research labs, they always want to focus on killing, destroying, or disabling the cancer cell itself, rather than addressing the oxygen deficient conditions in the body, which actually cause the cancer cells to materialize. Our normal, healthy body cells are aerobic, which means that they thrive on oxygen. But when the oxygen level dips below 65% of the preferred healthy oxygen level in any part of our body, the cells in that area click into survival mode, which means that they are going to do whatever it takes to survive in the current oxygen deficient environment, even to the point of transforming themselves into another anaerobic cellular form that does not need oxygen to survive, in fact can thrive with no oxygen at all. So here we have a little diagram where we see the happy normal cells on the left, and they're little ovals, but once that oxygen level decreases by 35% or more, they transform themselves into the cancer cells, which are no longer oval shaped, and you can see that they're sad faces. And what do they do next after transforming? They multiply as fast as they can to survive. Now, when you think about it, this ability of our body cells to make such drastic transformations for survival is nothing less than miraculous, and further demonstrates the genius of our Creator when the human body was designed. And when the cancer cells increase in numbers and become disruptive and overbearing to the normal cells in the near vicinity, the body tries very hard to contain them by bagging them up, along with all of their toxic waste products, into trash bags, which we call tumors. When this occurs, our body hopes that we figure out how to increase the oxygen level in that particular part of our body, so that our immune system will eventually kick in and the unruly bunch of cells can be destroyed and eliminated. If the oxygen deficiency issue is not addressed, however, then we put ourselves in danger of the cancer cells expanding beyond the tumor and spreading to other oxygen deficient areas in our body. This is called metastasis. This is one reason why I fail to understand why our learned physicians seem to always want to cut a little piece of the tumor off by performing a biopsy and examine the cells to see if they are malignant or benign. Once they find out that it is malignant, they have already put a hole in the body's trash bag to let the unruly cancer cells escape. Similarly, when we allow a surgeon to surgically remove a cancerous tumor, unless they remove a large portion of surrounding normal, healthy cellular tissue during the surgery, they usually leave behind some of the cancer cells, which again travel to yet another oxygen-deficient area and continue to grow rapidly, and thereby actually causing the very devastating result that they were trying to prevent. Now, how smart is that? I'm not a doctor, but it seems that when a tumor develops anywhere in the body, that you should automatically assume it to be cancerous and treat it accordingly, simply because it's an abnormal growth and collection of abnormal cellular tissue which doesn't belong there. It needs to be treated with natural, gentle methods that preserve the normal cells while attacking only the cancer cells, not cut or poisoned or burned out, all of which destroy not only the cancer cells but normal healthy cells as well. And what really irritates me is that doctors have known since the 1920s that surgery doesn't stop cancer, and yet they still perform mastectomy operations like they're going out of style. And maybe they are, as increasingly more and more women stop falling for the breast cancer hype and fear tactics performed by their very own doctors, and become educated with understanding about the true causes and natures of cancer. Dr. G. Everett Field, director of the Radium Institute of New York, observed in the 1920s, and I quote, "Blindly, we have been attacking cancer in its advanced stages for many generations with surgical effort, only to find prompt recurrence after removal. It truly pains me to see how many women are getting regularly scheduled mammograms, whose radiation levels have been proven to actually cause cancer. So now I've noticed that they have made mammograms absolutely free, knowing that eventually the frequent mammogram radiation exposures will ultimately cause the cancer cells that they seek to actually appear. And they will have yet another willing participant in the cancer game of suffering, death, and destruction for dollars." So, you may ask, how do we raise and maintain the oxygen level throughout our bodies and keep it from ever reaching that critical 35% deficiency level? which forces our cells to go into survival mode and transform themselves into frantic cancer cells. There are several alternative and natural therapies to accomplish that, some of which are discussed in my next video tutorial entitled Understanding the Simplicity of Curing Cancer. For more information about cancer, natural cures, and alternative cures, please visit one of our websites at www.yournaturalcancercures.com, yourcancercure.net, or herbsforlifenow.com. Or you can send any specific questions, suggestions, or comments to yournaturalcancercures@gmail.com. Many thanks for viewing this video, and be well, get healthy, stay strong.